Hi Maggie, my name is Wei. I'm a student of physical therapy. Is it okay if I work with you today? Good, perfect. So today's plan, we're going to help you go from the seated position that you are in right now to standing up. And of course, I'm going to be providing enough support so to help you stay upright. And in order to do that, we're going to be using a head and hip strategy, which is moving our head and hip in opposite direction to help us shift our weight forward. So let's do that first to help you scoot to the front. Good. So 1, 2, 3. Good. 2, 3. Good. Perfect. 3. Good. We'll do one more. 1, 2, 3. Good. Now I want you to use your upper extremity to hold on to the parallel bars. And same thing, we're going to use a head and hip strategy, and I want you to use your arms to push up. Good. Perfect. And now, okay, so now we're going to do some lateral weight shift to help you stay upright and challenge your stability. So lean towards your right for me. Good. And of course, I'm going to be assisting you by holding onto the weight belt. One more time, right, left. Good. So now we're going to do a little challenging version. So I want you to shift to your right and do it just enough so your left leg is off the floor. Good. We'll do the same thing. Good. Perfect. So now we're gonna ambulate towards end of the parallel bars, and I want you to use a step 2 pattern and using your upper extremity to help you move forward. And we're gonna be utilizing the head and hip strategy as we mentioned before. 1, 2, 3. Good. 1, 2, 3. Good. Just one more. 1, 2, 3. Good. Perfect. Good. So now we're going to use the head and hip strategy again to help you get back into the wheelchair. But this time we're going to do a reverse. So head forward and pelvis back. 1, 2, 3. Good. Patient BD is a 24-year-old male T10 Asia B sensory incomplete with 5 out of 5 bilateral upper extremity strength and 0 out of 5 bilateral lower extremity strength. For ambulation, I chose the step 2 gait pattern by utilizing the tension in patient's hip flexor. This is my first time working with the patient, but by making observations throughout the session and patient's presentation of strength and age, I will use a swing through or swing 2 gait pattern for the next from now on. I provided moderate assistance throughout the session, and for intervention, I chose lateral weight shift to work on patient's upright tolerance and posture control. For ambulation, patient will be wearing bilateral KFOs due to the 0 out of 5 bilateral lower extremity strength. And to progress with ambulation, we can change the parallel bars to walkers for the patient to use as assistive device with less support.
Hello, Mr. Shu. My name is Maggie. I'm going to be your student physical therapist. Is it okay if I work with you today? What we're going to do is to move from wheelchair to short sitting at the edge of the bed. So what I'm going to have you do first is to hook your arm around the wheelchair. Then move your left leg around. You can hook your arm under to help with that. Perfect. I'm going to have you lean into your right side so that I can put the transfer board under. Good. Now you can return back to your position. During transfer, I want you to lean into me, so move forward, lean forward. We will be moving on a count of 3. On each count, I want you to move your eye away from it. I'm gonna place your hand over here. All right, 1, 2, 3. Good. Let's do that one more time. 1, 2, 3. Great, that was perfect. So now I'm gonna have you lean into your left side so that I can take the transfer board out. Good. Now I want you to lower yourself onto your right elbow and I will help you move your legs up. Next, try to squeeze your shoulder blade so that you can swing your left arm to the back. Now onto your elbow, I will be in the back supporting you. Now imagine punching your left arm out. Good. Let me bend your knees here. Next, hook your wrists together like that. Swing across your body and make sure your eyes are following it. 1, 2, 3. Good. Next, you're going onto your elbow into a forearm prop. I'm gonna help you with this movement. Try to press your elbow into the table. Alright, good. Now, Further press into the table and make tiny steps. Good. Alright, now try to grab your legs with your arms. Don't worry, I'll be supporting you in the back. Now hook your left arm underneath your legs and then try to move it down to the table. Perfect. My patient is a 22-year-old male post-motor vehicle accident with an Asia B, C6 spinal cord injury. Today we practice wheelchair to short sitting, where I provide a pelvic support as he leans into me for leverage. For short sitting to supine, I assisted with leg lifting and scapular support as he lowered. On return to sitting, I stay behind to initiate and support his C-crawl. Since he is wearing a Miami J collar, he couldn't use the head-hip relationship, so I had him mimic the movement with his eyes. Next session, we can practice shoulder depression during forearm prop to help with C-crawl.